For those of you I may have not met yet, my name's Allie. I'm the PGY2 Pediatrics resident. Thanks to Monica for being my content expert for this presentation, and also thank you to Luke Schultz and Mary Mabley for helping with the initial creation of this topic. So here's my objectives today for my presentation, which we will walk through. And first, I wanted to start with a few example scenarios to keep in mind throughout the presentation that you may or may not resonate with. So picture this first scenario as I'm describing it. You're a full-time staff pharmacist, and you used to love coming to work every day, but now every day you feel completely drained. It feels as if patient acuity is so much higher, hospitals and red census every day, your department is short-staffed, and you're being pushed to your limits to still provide the highest quality of care despite really high workload demands. And on top of all of that, you're still trying to be a superstar mom at home, but since you're having to pick up extra shifts at work, you're spending less time with your kids and your husband, and you're devoting less time to taking care of yourself. You're feeling stretched really thin, and you don't know what to do. The second example here for you to imagine is you're a PGY1 pharmacy resident. A few months ago, you were so excited to have graduated from pharmacy school and finally be able to start your career as a pharmacist. You finished orientation, you love your co-residents, and you're finally starting to get a grasp on handling this new part of life. However, November starts to creep in, and all of a sudden your feelings are shifting. You're feeling the pressure to make a decision about pursuing PGY2 or not. You're trying to manage your year-long research project while also staying on top of rotation responsibilities. Staffing is taking a toll on you. Mid-year is coming up so soon. You're feeling so stuck with no idea on how you're going to keep up with all your responsibilities and continue to impress your preceptors. On top of all of that, the holidays are coming soon. This will be your first holiday season away from your family, which is going to be really tough for you. And then here's the last scenario for you to picture. You're a fourth-year pharmacy student. At the beginning of the year, you were ecstatic to finally be out of the classroom and into the clinical settings to put all the information you learned over the last 3 years into practice. You matched to an awesome AppERT program with an awesome cohort of other students, and you're really riding the high on how well your first few rotations have gone. But now you're getting closer and closer to residency application season. All of a sudden, it's November, and you're feeling overwhelmed with how much you need to do over the next few months. You have to write all of your letters of intent, polish up your CV, submit the applications, and get your game face on to start preparing for residency interviews. Residency is all that's on your mind, but somehow you still have to also put all your effort into your rotations and projects. You're the busiest you've ever been, and it's hard to keep the final goal in sight. And you're really missing your friends who are your biggest sources of support due to being located in different areas around the state for rotations. So why are we talking about this today, and do any of these three situations feel familiar to you? If so, you may have or may currently be experiencing burnout. Burnout is a real issue within the realm of healthcare for multiple professions and at all stages from learner to seasoned professional. Burnout can become detrimental with serious consequences if not addressed. Due to the severity of the issue and its rising attention across national healthcare organizations, it's important for us to understand more about burnout. We're approaching the holiday season where intense emotions may arise due to family circumstances. Workplaces may experience higher levels of stress. The weather is always cold, and it's always dark outside. Overall, this is a very high-risk time for declines in mental health and well-being. The goal of today's presentation is to realize the current state of healthcare professional burnout, the consequences it can have, and what we can do about it. So that brings us to our first objective here, to define burnout and recall why it's important to prevent in healthcare professionals. Burnout is evident within all healthcare professionals, but I wanted to specifically call out pharmacy professionals throughout this presentation, since we are all pharmacists. Every few years, multiple national pharmacy groups such as ACCP, ASHP, and APHA collaborate to compile the National Pharmacist Workforce Study. The most recent one was completed in 2019, with the one before that in 2014. The purpose of this study is to characterize demographics, work-life balance, work contributions, burnout, discrimination, and retirement within the pharmacy profession. So a questionnaire was sent out via email to over 90,000 pharmacists, and 2019 study received just about 5,500 responses. 71% of full-time pharmacists reported that their workload level was high or excessively high, which is higher than the last two completed workforce studies. 47% of pharmacists reported feelings of decreased job security, And when comparing work attitudes between 2014 and 2019, results suggested that the quality of work-life balance was lower in 2019. Of the reported reasons for jobs being highly stressful, the three most common were having so much work to do that everything cannot be done well, working at current staffing levels, and fearing that a patient will be harmed by a medication error. Scores for professional fulfillment were low, and scores for work exhaustion were high, indicating burnout in the workplace. The National Pharmacist Workforce Study evaluates pharmacists across all practice settings, but there's also multiple studies published recently evaluating burnout specifically only in hospital or healthcare system pharmacists. The first study is a summary of an email survey sent out to ACCP members. 974 pharmacists responded to that survey, with the majority reporting being dissatisfied with their work-life balance, having too many non-clinical responsibilities, not having enough time for personal growth, and working too many hours. The overall burnout rate was reported at 61%. A similar study was published in AJHP in 2018, where an email survey was sent out to the Vizient Network members, and that included administration, clinical pharmacists, and residents. 329 responses were included in the analysis, and all of the responses indicated a high degree of burnout in all three subscales, evaluating emotional exhaustion, depersonalization, and reduced personal accomplishment. And then lastly, as you may imagine, due to the high acuity of the patient population, critical care pharmacists are at high risk of burnout. ASHP members who identified themselves as critical care pharmacists were sent an email survey, and 193 responses were analyzed. Respondents were scaled as high risk in anywhere from 1 to 3 of the subcategories, and higher levels of burnout were associated with more years of practice and lower awareness of resources for resilience within their institution. Another population of pharmacists who are at high risk of burnout due to some possible unfortunate diagnoses in their patient population is hematology-oncology pharmacists. A study was published in 2021 summarizing survey results from an email sent out to hem-onc pharmacists involved in the Hematology-Oncology Pharmacy Association, or HOPA, which had over 600 responses. Of the pharmacists who responded, 62% of them reported levels of high burnout. Pharmacists with high burnout reported concern for having made a major medication error in the past 3 months compared to pharmacists without high burnout, with a p-value of less than 0.001. 1 of every 5 pharmacists who responded had concern of making a recent major medication error. 27% of those pharmacists reporting high burnout said that they were likely to leave their job within the next 2 years. And then lastly, one thing to note about this study is that the survey was distributed during the height of the COVID-19 pandemic, and 62% of pharmacists reported a decrease in well-being during the pandemic. The pharmacists reporting high burnout correlated with decreased well-being during the pandemic, with a p-value of less than 0.001. Another study published in 2022 was the results of an email survey, again sent out to HOPA pharmacists with over 600 responses. Overall, 78% of them were satisfied with their job. However, 60% reported that they were considering another career. Reasons for considering other careers included work burden, burnout, and work-life balance. Respondents were able to free text items they thought would help with the current state of the hem-onc pharmacist workforce, and responses included more support, better patient ratios, feeling valued, protected time for non-patient care responsibilities, and more support for employee mental health and well-being. Pharmacy learners are also at high risk of burnout, both students and residents. So 2 studies have been published in the last few years evaluating burnout amongst pharmacy residents. One study published in the American Journal of Pharmaceutical Education in 2018 evaluated stress among PGY1 pharmacy residents. An email survey was sent out to over 1,000 RPDs who were asked to forward to their residents in all practice areas. Questions on a perceived stress scale were asked. Over 500 residents responded, with the majority being female. Females are more likely to report higher levels of stress compared to males. And top stressors included time pressure, work overload, and fear of error. More than 50% of residents reported working more than 60 hours per week, and on average, residents only get 6 hours of sleep per night. The second study was published in AJHP, which was conducted very similarly to the previous study, where RPDs were emailed a survey to forward to their PGY1 and PGY2 residents, with again over 500 responses received. PGY2 residents reported working more hours than PGY1s. However, stress levels did not change between the 2 years. But on the other hand, PGY2s are more likely to have higher negative affect levels compared to PGY1s. Working more hours, anxiety, depression, and negative affect were correlated to higher levels of stress. So now we know that burnout is a real thing, but what does it actually mean? So according to the Maslach Burnout Inventory, it's a psychological syndrome of emotional exhaustion, depersonalization, and reduced personal accomplishment that can occur among individuals who work with other people in any capacity. And as you might notice, this is a pretty broad definition as it states, because it can occur in any industry, such as healthcare, fashion. And the key here is knowing that the emotional exhaustion results from depletion of emotional resources. Depersonalization results in negative attitudes. At work, emotional exhaustion. And reduced personal accomplishment is from the negative attitudes when evaluating yourself. So all these symptoms of burnout can lead to decreased quality of care or services provided. And burnout isn't something that just happens, but rather there are many individual and external factors that contribute to the development of burnout. Some of these factors are listed here. So as you can see, there's a total in this National Academy of Medicine construct, there's a total of 31 factors, but I have added here just a few of the ones that may be more relevant to us, which can include inclusion in the workplace, financial support, engagement at work, overall well-being, support at work, competency within the workplace, and then also teamwork. And then some of those external factors of burnout, there are many of them as well in the competency that the National Academy of Medicine has published, but the ones included here are safety, the patient status at work, human resources department, compensation, HR policies, the support of leadership, and then also diversity within the workplace. So the Mayo Clinic wrote a descriptive review about the burnout epidemic among U.S. physicians, but we can acknowledge that similar descriptors can be used for other professionals as well. Metrics, short staffing, demand for patient care, many factors impact well-being of physicians and also pharmacists. Demands are creating exhaustion and burnout, as we may know, and burnout can cause professional consequences such as decreased quality of care, increased medical errors, decreased patient satisfaction, decreased productivity, and increased turnover. And on the other hand, it can also cause personal consequences as well, such as relationship strain, alcohol and substance use, depression, and even suicide. So these consequences must be addressed to improve the well-being of healthcare professionals. More on the consequences of burnout. Part 1 of a series published by Gallup, which is an analytics and advice firm, evaluates the top 5 causes of burnout and what consequences it can have on employees, not specifically healthcare professionals, but all employees. Results from the study showed that 23% of employees feel frequently burned out and 44% feel burned out sometimes, so a total of 2/3 of all employees. Employees who frequently experience burnout are more likely to take a sick day, are less likely to discuss goals with their manager, more likely to visit the emergency room, more likely to leave their current employer, and less confident in their work performance. Knowing all this wraps up our first objective, and we have our first learning assessment question. So AS is a pharmacist at Cloudy Storm Hospital. She has a lack of resources to maintain her emotional stability of work hardships, which results in her having a constant negative attitude at work, and she feels unproductive from being persistently negative. So which of the 3 characteristics of burnout is AS experiencing? Okay, I'm seeing a few D's in the chat, and yes, that is correct. So AS's characteristics as described, she has all 3, the emotional exhaustion, depersonalization, and reduced personal accomplishment. So here's our second objective: to identify the impacts of a healthcare professional experiencing burnout and methods to address burnout. Similarly to the consequences of burnout that were just mentioned, there's also larger scale impacts of burnout syndrome for us to consider. So healthcare professional burnout can result in moral strains on relationships and personal health, along with the larger impact on society. Along with that comes safety concerns from burnout, such as increased safety events, personal safety, and organizational safety. Quality of care may also be affected from burnout due to increased errors and variability in care provided. Increased burnout can cause decreases in productivity and career longevity, and increases in staff turnover and recruitment time, all which cause financial impacts on the institution. And then lastly, and arguably most importantly, the patient experience is affected by burnout syndrome as well, because patients really experience healthcare through the healthcare worker. And if they're sensing burnout, they'll have a poor perception of the care that they are receiving. As you may imagine, the COVID-19 pandemic has also drastically affected levels of burnout among all healthcare professionals. Despite managing our own health, we've also now been tasked with managing a changed healthcare system, new isolations, new technology, and new mental health challenges. Specific problems to note from the pandemic are feelings of despair and hopelessness, fear for loved ones, decreased job security, increased loneliness, online meeting fatigue, increased alcohol use, unhealthy eating patterns, increased anxiety, decreased financial security, social withdrawal, sleep disturbances, decreased physical activity, and the list goes on and on and on. Throughout the pandemic, 1/3 of Americans now have clinical anxiety or depression, which is the highest these rates have ever been. Mental health was already a public health epidemic prior to the pandemic, but has now worsened and deserves even more attention. So optimal self-care is needed during times of crisis, such as the COVID-19 pandemic. Creating awareness of the status of mental health amongst healthcare workers, both before and after the pandemic, is crucial to be able to evaluate level of burnout and what we can do about it. So this infographic was created by the National Academy of Medicine, and it highlights some of the most alarming statistics, including how almost half of physicians now have clinical depression, 1/4 of primary care nurses have emotional exhaustion, and 1/4 of ICU nurses have symptoms of post-traumatic stress disorder. These are extremely high rates of mental illness amongst our colleagues and can impact the level of care that is provided to patients. Finding the optimal balance of productivity and motivation, but not crossing the line resulting in too much stress, is difficult. It's a slippery slope. Some stress is good for you and helps enforce productivity, but when stress becomes too much, that's when problems arise. So the Yerkes-Dodson law describes just that. As you can see, the graph demonstrates how performance increases with stress, reaches the optimal level of stress and performance, but then performance will decline after that when stress becomes too high and workers are at risk of burnout. So if your stress is either too low or too high, you're not maximizing productivity, and stress levels need to be addressed prior to reaching the downhill of the curve and spiraling into burnout. If there is suspicion that burnout is prevalent, objectively measuring it is important in order for it to be addressed. While measuring burnout can be done in an individual, typically it's conducted within a group, and group responses are combined to assess overall burnout. The first reason for why it must be measured is because there's no way to definitively know that there's burnout unless it's assessed. Secondly, completing an assessment of burnout will allow for those causes to be identified, and then once identified, targeted interventions can be made to address the burnout. And then lastly, the baseline level of burnout needs to be addressed so that burnout can be measured again after the intervention is implemented to see if the changes were effective in reducing the level of burnout. There's two main standardized methods used to measure burnout, and they should be used together. The first one is the Areas of Work-Life Survey, which aims to assess for the causes of burnout within the workplace, and respondents will answer on a scale of 1 to 5, with 1 being strongly disagree and 5 being strongly agree. The areas of the survey that are assessed are workload, control, reward, community, fairness, and values within the workplace. And the second method to assess burnout used along with the Areas of Work-Life Survey is the Maslach Burnout Inventory, which assesses level of burnout by measuring the 3 core parts of burnout, so the emotional exhaustion, depersonalization, and personal accomplishment. After that, respondents will be placed into a profile type that categorizes them as engaged, ineffective, overextended, disengaged, or burned out. So while these surveys are evidence-driven, formal methods to evaluate burnout, there's also more informal methods to assess whether someone is experiencing burnout. Some of these can be free survey tools, just reflecting on work experiences, talking one-on-one with your leaders. But there's also a method that was proposed at the 2022 annual conference of HOPA pharmacists, who Dr. J. Brian Sexton, who works at Duke University in North Carolina, he delivered the keynote address, and the focus of his speech was encouraging pharmacists to fight against burnout. He encourages them to do this by reflecting on the following statements to see if they're burned out. And those are: you try to be everything to everyone. You get to the end of a hard day at work and feel like you've not made a meaningful difference. You feel like the work you're doing is not recognized. You identify so strongly with work that you lack a reasonable balance between work and personal life. Your job varies between monotony and chaos, and you feel like you have little or no control over your work. So reflecting on these questions can help identify if you're experiencing burnout. Another method to informally assess burnout is to compare your work attitudes against characteristics of burnout and engagement, which are listed here as their two polar opposites. So burnout can be characterized by being depleted, depersonalized, and discouraged, whereas engagement is energized, empathetic, and encouraged. So one may fall on either side of the spectrum or somewhere in the middle. So using these can help assess where you're at in terms of burnout. So now that we have acknowledged consequences of burnout and learned how to assess it, what do we do with that information? There have been multiple organizations, such as the National Academy of Science, Engineering, and Medicine, who have published some goals to help attack burnout. This report by the National Academy of Science, Engineering, and Medicine is very large, but it encompasses many of the topics discussed in this presentation, as well as actions to take to reduce burnout. The organization emphasizes that burnout can only be significantly memorized with a systems-based approach, as the individual cannot completely reduce burnout on their own. But here are 6 goals for health system leaders to pursue that the organization proposes, which are creating positive work environments, creating positive learning environments, reducing administrative burden, enabling technology solutions, providing support to clinicians and learners, and investing in research. Recall the 6 areas assessed in the areas of work-life survey, which are here in red on the left of the slide. There are specific steps an individual with the help of leadership can take to address burnout. So for workload, implementing allotted time during the workday to recover from stressful events has been found to be helpful. If you're feeling burned out due to lack of control at work, implement some clearly defined roles within the workplace for your responsibilities. If adequate reward is not being met, either institutionally or socially, try to find ways to make that up. If there is not adequate community support, promote participation in workplace organizations. If there is perception of lack of fairness, creating transparency with decision-making within the institution is helpful. And then if organizational values do not match your personal values, we have to find a creative way to make those goals align. Excuse me. One resource for employees that can help alleviate burnout or other issues within the workplace is an employee assistance program. So employee assistance programs are work-based interventions to identify problems that are affecting employees' work, and it can range from finances, relationships, emotions, or substance abuse, and we find ways to solve those problems. There is a wide range of services that can be offered, such as legal assistance, wellness programs, and counseling. So EAPs are at no cost to the employee to a certain limit, and it can be delivered in person, virtually, or over the phone. UW Health does have an employee assistance program called Life Matters, which is free services for up to 10 sessions of your choosing. You can follow this link on the slide to learn more about Life Matters and also information on how to enroll in the free services. And these services can be accessed through reaching out to Life Matters via phone call, text message, website, or a downloadable phone application. So recall we mentioned a little bit earlier Dr. Sexton from North Carolina, who delivered the keynote address to the Hope of Pharmacists. During his speech, he proposed a small intervention to combat emotional exhaustion and burnout called 3 Good Things. This small technique asks you to answer 3 questions at the end of the day as reflection, which are: what went well today? What was your role in making it happen? And which one of the following emotions best fits how this good thing makes you feel? Amusement, awe, gratitude, inspiration, interest, joy, hope, love, pride, serenity, or other. So focusing on what went well and what was in your control for the day allows you to help realize all the effort that you put into your day to do the best you can for your patient. And lastly, before we move on to the next objective, there's one more special population that I specifically wanted to address and not forget that is at risk of burnout, which is learners within healthcare professionals. The term learners encompasses students and residents, medicine, pharmacy, nursing, and there have been studies assessing burnout in each of those types of learner. Learning environments can help learners thrive or become susceptible to burnout because ultimately the environment shapes the learner. Learners already feel pressure to impress preceptors, be the best, and compete with others for the next best step, whether that be residencies or full-time jobs. If they are not given adequate education, resources, and strategies to prioritize well-being, burnout risk increases, and burnout and well-being need to be addressed while being a learner to set the stage for future careers, how they're able to become future educators, and how they approach well-being and resilience. Lastly, the workplace can only change if the burnout of all people is addressed, which includes both employees and learners. So knowing that our learners are at equal risk of burnout, just like employees, interventions have to be used to protect the well-being of learners. Examples of these that can be used are more diligent tracking of duty hours, which UW Health and UW School of Pharmacy both do, preparing learners for the number of hours that they work, targeting teamwork on the learner and preceptor end, and then also participating in teaching workshops. So as you may have picked up on throughout this objective, reducing burnout is not easy at all. It can't happen overnight. It's not able to be done by one person. It really does take a village to improve someone's well-being. One simple solution cannot fix burnout, so creative solutions are needed to help address this big problem. So knowing that individuals and leaders need to all have an open mind to new solutions to support the well-being of others. Our next learning assessment question here. So remember AS, who's the pharmacist at Cloudy Storm Hospital. As her friend, you notice that lately she's not been acting quite the same, and you have a significant concern that she's experiencing burnout. So which of the below is not a technique to address her burnout that you could recommend to her? So would you recommend the employee assistance program, reflecting on 3 good things after each day, recommending to sleep it off as she'll be fine tomorrow, or recommending that she speak with her manager to ensure her values align with the hospital's? Okay, I saw a few C's, and that is correct. Recommending that she sleep it off as she will be fine tomorrow is not one of the evidence-based strategies to address burnout in the workplace. Our third objective is to summarize well-being and methods to promote well-being. So we've talked a lot about burnout and negativity and sad statistics, but hope is on the horizon, so let's go ahead and flip the script and talk about well-being, because even when situations get tough, we can turn them around by promoting wellness. So well-being is a very general term describing a state of being happy, healthy, and prosperous. When someone describes that they have well-being, that generally means that there's a presence of positive emotions and absence of negative emotions. Along with that, it is generally synonymous with overall satisfaction with quality of life, feeling fulfilled, and functioning in a positive manner. Well-being can also encompass physical well-being if that is a priority to the individual. So while we might have a general idea of what well-being is, there really has never been a true definition of well-being established because it's a growing area of research. There's various dimensions of well-being rather than one strict definition, and it can be thought of as an equilibrium, since one may not always be at their most well state at all times. The set point theory describes how each person's personality, life events, and well-being places them at a general set point, but however, after major life events, people should return to their set point and baseline level of happiness after adapting. There is thought that well-being is fairly stable with room to move on either side of the scale pending current circumstances, and individuals develop resources to help guide them through challenging times that baseline well-being can be maintained. However, if resources become unavailable, then well-being may be affected. So overall, as we can summarize here, well-being has a general set point. Equilibrium is essentially inevitable, but the state of well-being can fluctuate. A study was published in 2011 evaluating the effects of hospital workplace factors on the psychological well-being and job satisfaction of healthcare employees. Over 200 healthcare workers responded to a survey evaluating their workplace, and factors affecting well-being were split into two categories, workplace and individual. Examples of workplace factors that impacted well-being were physical workplace conditions, tasks related to the job, control of workload and tasks to complete, interpersonal relationships at work, and organizational involvement. And individual factors that were reported to affect well-being were emotions, stress levels, motivation, confidence, personal relationships, engagement to the job, and personal achievements. So knowing that well-being is a balance and somewhat of a set point, and we've identified factors that may affect well-being, we have to create methods to increase well-being. The Mayo Clinic created 9 organizational strategies to address healthcare professional burnout and increase well-being, which you can see here on the slide. Some ones that I wanted to highlight is that utilizing peer support and a sense of community within the workplace can be a resource to decrease burnout. And then also consider appropriately using rewards as incentives to motivate yourself or others around you. And while these items on the slide are largely institutional-based changes to support well-being, individuals can brainstorm how these strategies may help with burnout and bring ideas to their leadership. Similarly but different, well-being and self-care are sometimes used interchangeably, but they do have different meanings. So Dorothea Orem was a nurse with a bachelor's and master's degree in nursing, who then received multiple doctorate degrees. She passed away in 2007, but throughout her career, she changed the profession of nursing by focusing on both the care of patients and nurses. So similar to well-being, there isn't one exact definition of self-care, but she defined self-care as the practice of activities that individuals initiate and perform on their own behalf in maintaining life, health, and well-being. Self-care goes hand in hand with the topics of burnout and well-being. So by regularly practicing self-care, we can enhance well-being and address burnout. Self-care can be implemented as a daily process to create awareness of one's needs and fulfill them through behaviors and actions that reduce stress. And ultimately, the goal is to have these acts of self-care improve emotional and physical health. And by improving these, this can increase productivity, self-esteem, and overall happiness. If someone is in a self-care deficit, they'll not see the benefits of self-care, such as reduced stress and increased happiness. She created a self-care deficit nursing theory, so specific to nurses and the care they provide to patients, but its principles can also be applied to more than just the field of nursing. The overarching goal of the theory was to empower people to care for themselves, whether it be a patient managing their own diabetes or a healthcare provider managing their own well-being, and be able to recognize when self-care is not possible due to surrounding circumstances. So this theory recognizes a few key principles relating to self-care deficit, which the first one is that increased support is required when an individual is incapable or limited to providing their own self-care. The second is that self-care deficit can occur when individuals' needs for self-care outweigh their ability to provide their own self-care. Third, that self-care deficit can be attributed to stressful demands of the increased work hours and workload. And lastly, that self-care deficit leads to physical symptoms such as fatigue, insomnia, frustration, anxiety, feeling overwhelmed, and lack of empathy. So this theory emphasizes that more support may be needed in times when someone is in a self-care deficit. There are 4 areas of self-care where one could potentially be experiencing a deficit, and acknowledging that deficit to fill in gaps can be beneficial to one's self-care and overall well-being. The first area is physical, which is movement of the body and meeting your daily needs for health and nutrition. The next is social self-care, which includes actively engaging with your support networks. The third is emotional self-care, which includes acknowledging your own emotions, increasing empathy, and appropriately managing stress. And lastly, professional self-care includes sharing your strengths to live your purpose. And small changes can be made each day to help fill deficits in any of these 4 areas that may be requiring a little bit of extra self-care. Self-care plans can be made when there's areas of deficits that are noticed, or preemptively to prevent deficits, or at any point in time to help create accountability for self-care. So self-care plans are similar to SMART goals, where they're specific, measurable, achievable, relevant, and time-bound. So while I have multiple areas for self-care that I am personally working on, I provided some examples here from my own self-care plan to share as an example. And the key here to note is that you should always frame your plan as you are choosing it, to really emphasize the aspect of self-care and that you are taking care of yourself, because you need to actively choose to do it to prioritize your own well-being. So some key areas from my self-care plan include exercising, eating healthy, communicating with my family, asking for help when I need it, and choosing to meet with my mentor. So here's our third learning assessment question. I asked back our pharmacist at Cloudy Storm Hospital who's experiencing burnout. As her friend, you would like to help her create her self-care plan to improve her well-being. So which of the below is a pearl to share with her regarding creating a self-care plan? To begin each section with I am choosing to, recommending to her that you only have to follow the self-care plan when you feel like it. Self-care plans don't really work, so it's not worth making one. Or lastly, do not share your self-care plan with others because you don't want them to know you're experiencing burnout. Okay, I'm seeing a few A's, which is correct. You would like to recommend to her to begin each section of her plan with I am choosing to create accountability. All right, our last objective for our presentation here, to explain resilience and methods to build resilience. So the last topic that I'd like to talk about to wrap up burnout and well-being in a full circle is resilience, which can be defined as the process of adapting and protecting yourself when faced with stress, adversity, or crisis. Along with that, resilience is a set of skills, behaviors, and attitudes that contribute to overall well-being, such as physical, emotional, and social. And all aspects of resilience allow one to prevent burnout and create a positive life despite difficult experiences that may present to the individual. Besides increasing well-being and preventing burnout, there's many reasons for why having strong resiliency skills is crucial for success. So as your resilience builds, your overall distress level will decrease, and that minimizing distress will then allow you to be more present in the moment and have more compassion towards others, such as your loved ones or your patients. Other factors that can increase with strong resilience include more mental capacity, energy to focus, and ability to empathize with others that surround us. So the energy and ability to empathize then results in greater appreciation for your support networks and overall improved relationships. ASHP is a sponsor of the National Academy of Medicine's motion to help address this important patient care issue. And ASHP has goals as part of their Action Collaborative, which are posted here, which mention optimizing medication use and sustaining the pharmacy workforce well-being. ASHP also mentions that pharmacy resilience is one of their goals for their strategic plan to improve patient care, and they published a new policy position 1825 on clinician well-being and resilience. So as you can see, clinician well-being is a high priority for ASHP. Since we know that resilience is important and we can see how much of a priority it is from national organizations, what steps can we take to improve our resilience and overall ability to function as a workforce? Many strategies can be implemented to improve resilience that are listed here on the slide. A few of which I'll mention are finding a mentor, developing strong connections, gratitude practices such as the previously mentioned 3 good things technique, self-care, and mindfulness. So monitoring stress levels is crucial to realize where on the spectrum you are towards burnout, to know how much intervention needs to be done to build resilience, as sometimes will require more resilience than others. Another thing you see on the slide here is cognitive reframing, which is a technique that can be done to more deeply evaluate a situation through a different lens, such as by thinking how others would view the situation, how long the situation may last, and what you can do to grow from the situation, which will help you get through those tougher times. Lastly, since we know that stress can make a big impact on our overall burnout, well-being, and resilience, it's important to identify techniques to adequately manage stress. There's 4 key strategies to manage stress that go hand in hand with techniques previously mentioned to build resilience, but stress needs to be monitored to be aware of how much stress you are under, such as by keeping track of how much you're sleeping, the types of foods you're eating, and how often you're getting frustrated. In times of stress, decompressing with healthy activities such as drinking tea, practicing yoga, journaling, reading, meditating, or listening to music should be done, or whatever works best for you to decompress. Savoring the good moments from the day by reflecting on them, recording them, and planning how to have a good day tomorrow are all positive techniques. And then lastly, continuing to foster healthy connections with others that you can trust can be a good sense of support for you to manage your stress. Okay, our last learning assessment question from the presentation. So AS is experiencing burnout still. She recognizes that her burnout is becoming a problem and she would like to build some resiliency skills. So which of the following would you not recommend for her to help build her resiliency skills? Connecting with a supportive mentor, working even harder as that will intrinsically build resilience, practicing gratitude each day, or practicing cognitive reframing. Okay, I'm seeing a few Bs, and that is the correct answer. So overall conclusions from our presentation today. As you may have noticed, burnout has many serious consequences, so we need to prioritize our well-being and build resiliency skills in order to prevent burnout as both pharmacy learners and staff pharmacists. Burnout prevention comes from the individual level and from leadership within the workplace. However, the concepts of leadership were not touched on in the presentation. A key takeaway to remember is that in order to prevent burnout within our workplace, we need to help each other and look out for each other as colleagues through building relationships to ensure well-being here at UW Health. Prioritizing our well-being will be beneficial to both ourselves and our patients, and I really hope this presentation has provided you with a few small steps you can take to begin to prioritize your well-being and address burnout if you are experiencing that. Here are some resources to learn more if you are interested about the topics mentioned in this presentation. ASHP has a Wellbeing and Resilience Certificate where you can become a certified well-being or wellness ambassador through ASHP. Linked here again is also UW Health Employee Assistance Program, Life Matters. And then as I referenced throughout the presentation, the National Academies of Science, Engineering, and Medicine book to take action against clinician burnout is a resource that you can utilize. Here are my references, and what questions do you have for me today on the presentation?